Albuterol. Uses. Albuterol, also known as salbutamol, is used to prevent and treat wheezing and shortness of breathing caused by breathing problems such as asthma, chronic obstructive pulmonary disease. It is also used to prevent asthma brought on by exercise. It is a quick relief medication. Albuterol belongs to a class of drug known as bronchodilators. It works by relaxing the muscles around the airways so that they open up and you can breathe more easily. Controlling symptoms of breathing problem can decrease time lost from work or school. How to use albuterol sulfate 90 microcentigram. Read the patient information leaflet and instruction for use provided by your pharmacist before you start using this medication, and each time you get a refill, follow the illustrated direction for the proper use of this medication. If you have any question, ask your doctor or pharmacist. Some brands of this inhaler have a built-in sensor that can store data on its use. This information can be used with the smartphone application. Read the manufacturer's information on how to set up and use the app. You do not have the app in order for the inhaler to work. You can review the data and share it with your healthcare provider if you want to. Inhale the medicine by mouth as directed by your doctor, usually every 4 to 6 hours as needed. The dosage is based on your medical condition and response to treatment. Do not increase your dose, so use this drug more often than prescribed without your doctor's approval. Using too much of this medication will increase your risk of serious side effects. If you are using this medication to prevent asthma brought on by exercise, using it 15 to 30 minutes before exercise. Do not use a spacer with this inhaler and do not open the cap unless you are ready to take a dose. Before use, hold the inhaler upright and open the cap. You should hear a click, which means the inhaler is ready for use. Place the mouthpiece near your mouth and breathe out as far as is comfortable. Do not breathe into the inhaler device. Then put mouthpiece in your mouth, close your lips around it and breathe in steadily and deeply. However, breathe for about 10 seconds or for as long as it's comfortable. Close the cap after each use. Clean the outside of the mouthpiece with a dry tissue or cloth as needed. Do not use water or any other liquid for cleaning. If liquid gets into the inhaler, it may not work properly. Replace the inhaler if it has been washed or placed in water. If a child is using this medication, a parent or other responsible adult may need to help this child use the inhaler properly. If you are using other inhalers at the same time, wait at least 1 minute between the use of each medication. Always have this quick relief inhaler with you. Keep track of the number of inhalers used from each device. Discard the device after you have used the number of inhaler marked on the manufacturer's package. Learn which of your inhalers should use every day control a drug and which you should use if your breathing suddenly risen. Quick relief drug. Ask your doctor ahead of time what you should do if you have newer rosen cough for shortness of breathing, increased sputum, rosen peak for meter reading work up at night with trouble breathing. If you use quick relief inhaler more often, more than 2 days a week, or if your quick relief inhaler does not seem to be working well. Learn when you can treat sudden breathing problem by yourself and when you must get medical help right away. Tell your doctor if your symptoms do not improve or if they worsen. Side effect: nervousness, dizziness, shaking, headache, nausea, mouth, throat, dizziness, dryness, or irritation or unusual taste may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. This medication may raise your blood pressure. Check your blood pressure regularly and tell your doctor if the results are high. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effect. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effect including fast found in heartbeat. Get medical help right away if you have any very serious side effect including chest pain, irregular heartbeat, rapid breathing, confusing. Rarely this medication has caused severe, rarely fatal, sudden worsen of breathing problems, asthma, paradoxical bronchospasm. If you experience sudden breathing, get medical help right away. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice and symptoms of a serious allergic reaction including rash, itching, swelling, face, tongue, throat, severe dizziness, trouble breathing. This is not complete list of possible side effects. If you notice other effect not listed above, contact your doctor or pharmacist. Precaution. Before using albuterol, tell your doctor or pharmacist if you are allergic to it or to similar drugs such as levobuterol, metoprolol, salmeterol, or if you have any other allergies. This product may contain inactive ingredients such as lactose, milk proteins, which can cause allergic reaction for other problems. Talk to your pharmacist for more details. Before using this drug medication, tell your doctor or pharmacist to medical history, especially of heart problems such as irregular heartbeat, angina, previous heart attack, high blood pressure, seizure. This drug may make you dizzy. Alcohol or marijuana can make you more dizzy. Do not drive, use machinery, or do anything that need alertness until you can do it safely. Limit alcoholic beverage. Talk to your doctor if you are using marijuana. Before having surgery, tell your doctor or dentist about all the product you use, including prescription drug, non-prescription drug, and herbal product. During pregnancy, this medication should be used only when clearly needed. Discuss the risk and benefit with your doctor. It is unknown if this drug pass into breast milk. Consult your doctor before breastfeeding. Interactions. Drug interaction may change how your medication work or increase your risk for serious side effect. This document does not contain all possible drug interactions. Keep a list of all the product you use uh, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medication without your doctor's approval. Albuterol is very similar to levobuterol. Do not use medication containing levobuterol while using albuterol. Overdose. If someone has overdosed and has serious symptoms such as passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. Laboratory and or medical tests such as blood pressure, heart rate, EKG may be performed periodically to monitor your progress or check for side effects. Consult your doctor for more details. Avoid substances that can worsen breathing problems by causing irritation or allergic reactions such as smoke, pollen, dander, dust, and mold. Learn to use a peak 4 meter, use it daily, and promptly report worsen breathing problems such as reading in the yellow red range. Increased use of quick relief inhalers. Because the flu virus can worsen breathing problems, ask your doctor or pharmacist if you should have a flu shot every year. If you are using albuterol regularly and miss a dose, use it as soon as you remember. If it is near the time of the next dose, skip the missed dose, use your next dose at the regular time. Do not double the dose to catch up. Storage. Store at room temperature away from light and moisture. Do not store in the bathroom. Keep all medication away from children and pets. Keep the inhaler in the foil pouch until ready for use. Once removed from the pouch, throw away the inhaler after 13 months even if this is still medication left. Do not flush medication down the toilet or pour them into drain unless instructed to do so. Properly discard this product when it is expired or no longer needed. Consult your pharmacist or local waste disposal company.